Hello everyone, this is Dr. David. You can call me Margarita. Today we're going to review the 3 different AV blocks. And I know for those of you that are going through a medical surgical rotation and are confronted with that telemetry strip and they say, oh, this is a 1st degree or a 2nd degree AV block, sometimes you're flustered because you cannot differentiate them. But today we're going to learn a fast and easy way to do so. But first we're going to get some information on what these blocks are. Now, how I said, we're going to go over the AV blocks. AV blocks are basically a delay in conduction. So just like your phone needs energy, they need a charge, your heart needs this energy. And if you know the circulation of the heart is the SA node, then the AV node, then you have the bundle of His and the Purkinje fibers. So all of those things control a certain action in your heart. For example, the SA node is the kickstarter. So that's going to give the energy that the heart needs in order for those atria to fill. Then you go on to the AV node. The AV node is going to give the energy needed for those ventricles to start filling in preparation for contraction. If there at any times any type of block within any of those energy currents, the heart rate is going to be affected. And if the heart rate is affected, that means that the contraction was affected as well. So in a patient, you might find that they might have a 1st degree AV block, a 2nd degree, which has 2 types, and a 3rd degree. The 3rd degree being the most serious. But first, we're going to know some normals. So when you're looking at here, you have the PR interval. And if you look at this picture, that's talking about the P to the R wave. That interval is supposed to always be between 0.12 to 0.20 seconds. Then we have the QRS interval, which is the QRS. The normal should be under 0.12 seconds. And there should always be a P wave before the QRS complex. And that is important because that's going to tell you an atrial rate. So if you have a P wave, that is indicative of atrial filling. And if you have a QRS, that means that the ventricles are filling up in order to contract and take this blood through the valves into your lungs, get oxygenated, come back to the left side of your heart, and eventually reaching the aorta, where it's going to go to the rest of your body. So that is important to note because any change in those normals means something. Is it that the heart rate is too fast or too slow? And when somebody has an AV block, it's usually indicative that their heart rate starts to drop. And when we're talking about 1st degree, which is the most common one, this block means that there is some type of conduction issue, not that serious. It might be that the patient might have eaten too much potassium. And you know that potassium is a cardiac arrestor. So the higher the potassium, the slower the heart will be, to the point that if it's not treated, it can cause cardiac arrest. So maybe that patient ate too much of that, or maybe they're taking beta blockers. And if you've learned about beta blockers, you know that is a medication that's going to affect the conduction of the heart, and it's going to slow it down in addition to treating high blood pressure. So maybe they're on that, or even a calcium channel blocker that reduces the calcium that is being exchanged in your heart. And as you know, calcium for C, for contractility, calcium contractility is increased, so C and C. So it's trying to lower and normalize the heart rate. So these things can have an effect on the heart's conduction, and therefore a lot of these patients may develop a 1st degree AV block. The heart rate is usually between 60 to 100. But what changes is that the PR interval, although it is constant, it's greater than the 0.20 seconds. And if you see here, this is supposed to be the range, 0.12 to 0.20 seconds. So from the P to the R, it has become a little longer. It's going to be constant, where it's the same at every complex that you see. These patients are usually asymptomatic. It's important that you understand what symptomatic and asymptomatic is, because that will make a difference in the treatment of the patient. When somebody has an AV block, as it progresses, that's when they start thinking about other medications that they can give the patient, as well as a pacemaker. Then we go to the 2nd degree. This is when the block is progressing. So in 2nd degree, you have type 1 and 2. Usually when somebody has a 2nd degree AV block, It can be the same thing where they are on beta blockers, calcium channel blockers, or have eaten a lot of potassium. But also when patients are taking digoxin and they are showing signs and symptoms of dig toxicity, they can develop a second degree AV block, because digoxin can bring down that heart rate, and that has an effect on the conduction system of the heart. They can also develop a second degree from coronary artery disease, and in turn is going to cause bradycardia. So when we are looking at the heart rate for these patients that have a second degree, always remember that the atrial rate is going to be greater than the ventricular rate, because the problem is not in the SA node, which is what it's called the kickstarter of the heart, and it's what's going to allow the P wave to happen because the atria are filling. It has an effect on the QRS, which is the ventricular rate, because the AV node is what's going to give the energy needed in order for this complex to begin. So always think of that. The atrial rate, which is your P wave, is always going to be greater than your ventricular rate, because the AV node is going to control your ventricles action. So when you have a type 1 second degree, which you might have heard it as longer drop, it's a Wenckebach, and it's reflected in this picture here, there's going to be a greater than, you see the normal that says 0.12 to 0.20. This interval here from the P to the R is going to get a little longer and a little longer. And what happens? It can drop. So longer drop. So you see that there's no QRS complex. That is called a Wenckebach. That is what you call a type 1. The PR interval varies. It's not going to be like the first degree AV block, which is just that it is longer. So it might be, instead of it being between 0.12 to 0.20, it's probably going to be, let's say, 0.22, but it's constant. So it's 0.22, 0.22, 0.22 seconds. Here, it could be 0.22, 0.24, and then the QRS drops, and then it starts over again. So the PR interval is going to change at each of the complexes. In order for it to be a type 1, it has to be longer drop. So you have to have at a minimum of 2 in a row before the QRS drops. And then you have type 2. Here it has progressed further. As you see, it's pretty close to that third degree. So in type 2, they might start thinking of medication, because here you're going to have a heart rate that's going to be ranging between 40 to 60. So that patient may feel dizzy. It might have a negative effect on their blood pressure. So their blood pressure can be affected where it increases. The P wave, although it's constant, okay, there's a little change. Remember that in type 1 of second degree, you have longer drop, right? That QRS drops, and there has to be a minimum of 2 in a row before the QRS drops. In type 2, there is no minimum. So it can get longer and then drop again and longer. So at any time that QRS complex drops, which is why the atrial rate is greater than the ventricular rate, because at any time for type 2, that QRS complex can go away. Then we get to a third degree. The third degree is the most serious of them all, because here, remember we talked about the PR interval? Here, there is none in a third degree, because at any given time, there might not be a P wave, or there might not be a QRS complex. So the atrium and the ventricles are working in their own schedules, basically. There's a block that's not allowing them to connect or communicate. So there might be a P wave, or there might be a QRS, or there might not be a P wave, and there might not be a QRS. So there's miscommunication here. This patient's heart rate can be under 45. They can feel cyanotic because there's not enough blood being oxygenated by the lungs in order to reach the circulation. This also can be very deadly. The only treatment for a third degree AV block is a pacemaker in order for it to regulate that person's heart rate. So this is an emergency situation. Again, there is no relationship between the P and the QRS complex, okay? And some things that can cause a third-degree AV block is an MI, a myocardium infarction, a heart attack, vascular insufficiency, and congenital defects. So this has to be fixed immediately or the patient can die. So now we're going to move on to an easy way to remember the different types of blocks. Okay, so I want you to see this legend here. So the P wave in my story equals to the boss. The QRS complex is the employee. When I mention a discipline, that's talking about a pacemaker. And when I mention death, that's talking about termination. So always have this legend in your head when you're listening to my story. So in a first degree block, we have a boss that's waiting at work for his employee that's supposed to arrive every day at 8 a.m. However, the employee started to arrive at 9 every single day. So he is every day being late. So at this point, the boss is trying to monitor the situation. So the employee is arriving late every single day. Instead of 8, he is arriving at 9 and he is not changing that behavior. But the boss is monitoring the situation to see if he is going to change. So what does this translate in our first degree block rhythm? So the boss, which is the P wave, is there every single day waiting for their employee, which is the QRS complex. But what's happening? That instead of them arriving at 8 in the morning, they're arriving later, but every day is at the same time late. So instead of them arriving at 8, they're arriving at 9 every single day without a change. Now we move on to second degree type 1. So here the boss is waiting at the workplace and the employee shows up, but he shows up later and later and then doesn't show up at all. So what does that mean? That the employee shows up at 9 instead of 8. The next day shows up at 10 instead of 8. And on the next day, he just calls out and doesn't tell anyone. So at this point, the boss is getting concerned and is trying to see what are the options that he has in order to deal with this situation. So he has to go to the underlying source. Is it that he's having car trouble? Is it that he has a car at home that's not working for him, or do they have a car, or can they take the bus? So he's going to look at those underlying issues that can happen that's preventing this employee from coming to work on time and actually come to work. So if we relate it to the type 1 in second degree, the boss is still at work every single day waiting for this employee to arrive on time, but instead the employee arrives on Monday at 9 instead of 8, on Tuesday at 10 instead of 8, and guess what? On Wednesday, he doesn't arrive at all. And what does that tell you? That the QRS complex does not happen because of this block. So longer drop. Later doesn't show up. So at this time, again, he's going to look at those underlying factors that are affecting his employee in order for him to talk to him about it, so that we can prevent a further problem. For example, a discipline, which can lead to termination. Then we go to type 2. Type 2 second degree AV block. Here, you know what? Now the boss is still waiting at work. You see the P wave? But instead of the employee being later and later, he is late on Monday, and on Tuesday doesn't come to work at all. So there is no minimum of 2 days in a row getting later and later to work. Now he comes to work late, and on the next day, he doesn't come at all. He feels that he doesn't have to show up. So at this point, the boss has to really say to himself, should I keep this employee? I'm going to have to sit down with them, talk to them to see what's going on, because I might have to do a discipline in order for him to change his behaviors that can lead to termination. So how does that translate? There's always a P wave. The P wave is always present, but the QRS is not predictable. So they come later and they might not come at all. come late, not come at all. So there's no minimum of that 2 times in a row like it exists in the type 1 AV block, 2nd degree. Then we have a 3rd degree. At this point, things are getting very serious. The boss is fed up and they say, you know what? I'm not going to wait for the employee anymore to come to work, even though I need him. I'm going to just go do the work myself. Because in this case, the boss might be here and the employee might arrive, but then guess what? On Tuesday, the boss is not there because they said, I'm not going to wait for them to come to work. I'm just going to go do the work myself. So then the employee might arrive, and then here the boss is at work and the employee might not arrive. So the boss and the employee are in different communication terms. They're not communicating. They're on different schedules. And now the boss has said, if you don't do this way, you're going to be terminated. So what does that translate? There's the P wave and the QRS are unpredictable. The P wave might be present or the QRS might not be. The P wave might not be there. The QRS might not be there. So they're on different schedules. So as you see, the P wave is here, QRS is here. There is no P wave, QRS is here, P wave is here, QRS is not here, not here for the P wave, and then the QRS is there. So they're on totally different schedules. So again, in 1st degree AV block, it's just that employee gets there Monday, Tuesday, Wednesday, Thursday, Friday at 9 instead of 8. So they're late every day, but it's constantly late at the same time. And the boss is always there. So there's always a P wave. In 2nd degree type 1, the boss or the P wave is always there, but the employee arrives on Monday at 9 instead of 8, then at 10 on Tuesday, and then on Wednesday doesn't show up at all. So the P wave is always there. It's constant, but the one that's not predictable is the QRS, but it has to happen 2 times in a row before it drops. So longer drop is a Wenckebach. Then you have type 2. In type 2, the boss is always there, which is the P wave is constant, but you don't have that 2 in a row minimum. The P wave is there, the QRS, the P wave is there, the QRS drops. So on Monday, they're late at 9, the boss is still waiting. On Tuesday, they don't show up. On Wednesday, they're late. On Thursday, they don't show up, but the P wave or the boss is always there. No 2 in a row minimum. And in the 3rd degree, there is no communication between the P and the QRS. The P wave got tired of waiting, or the boss, and they might be there or they may not be there. Like in this case, the QRS might be there or they may not be there. So there is no communication. In 1st degree AV block, they just monitor the situation. They are going to take care of those underlying causes. For example, did they eat a lot of potassium? Are they on beta blockers? Maybe we need to discontinue them. In type 1, 2nd degree, the same thing happens, but also you can see this in patients that have digoxin toxicity because their levels are too high, so the heart rate drops too much, causing a block and bradycardia. Is there an infection that has to be treated with antibiotics that once that happens, it's fixed? In type 2, this is when they, in addition to those other underlying causes for type 1, this is when they start thinking about a temporary pacemaker because it might just be needed in the meantime while other causes are being fixed. But a pacemaker is in the plan of care for this patient eventually. It could be a month from now, 2 months from now, or 3 months from now, but it will probably happen. In a 3rd degree, the only treatment is a pacemaker. There is no treating the underlying cause as the priority. They may do that, but this is an emergency situation. The only way that heart rate is going to normalize is with a pacemaker. So I hope that this was useful to you. I'm going to do another lesson on beta blockers, so look forward to that video. And make sure that you like this video, subscribe if you haven't already, and share it with all of your friends. In the bottom of the comment section, make sure you're putting any suggestions of topics that you want me to cover, and I'll try to cover them as much as I can. And I want to wish you a great rest of your week. Bye.